Hello friends, in this video we are going to discuss about most common symptoms and warning signs of COVID-19. So the most common symptom of all is fever, which will happen in more than 3/4 of the patients, and more than half of the patients will experience cough, and nearly 1/4 of the patients will experience fatigue, loss of smell and taste, and difficulty in breathing. Nearly 1/5 of the patients will experience shivering, body pain, wheezing, headache, sore throat, joint pain, confusion, dizziness, and diarrhea. And also vomiting can be present. In the previous video of mine, I have suggested 10 tips to recover fast from home isolation. So the most challenging part is sometimes you may get RT-PCR positive without any of these symptoms, or with these symptoms with severe breathlessness also will be there. So you need to first consult a doctor, then you should follow the advice or the prescription of the doctor. Then while in home isolation, you should watch for the warning signs or the alarming signals. So during any physician's examination, they will try to do three things. First is the clinical examination, that is physically they will examine all your parameters whether you are normal or not. Then the second thing is, if necessary, they will go for some blood tests like CRP, ferritin, D-dimer, etc., and complete red count and all they will do. So based on that, there are some treatment options available which will help in recover COVID-19 faster. Then if needed, they may go for CT chest to identify the early lung involvement. So if these three things are done, and doctor advises home isolation, then you can follow those tips and wait for this alarming signs. That is, any of these five is present, then you should go for medical advice immediately. So number one is breathlessness, any change in the rate or the depth. So most commonly, the rate of normal breathing rate is 16 to 20. If the breathing rate is more than 24, then you can identify it as shortness of breath, or sometimes the depth of the breath may be increased. So if the fever is more than 5 days, and if the cough is more than 5 days, if you have any comorbidities, especially if you are having hypertension, diabetes mellitus, age greater than 60 years, obesity, having BMI more than 30. So all these things will contribute to the alarming signs. Then the most important thing which you monitor in home is the SpO2 through the pulse oximeter. When it drops below 93, the recent government guidelines says it is 92. When it drops below 92, then you should be alarmed. So these five are the warning signals predicting severe COVID-19. So then you should seek medical care. If you are not under any of those five alarming signs, you have simple cough, fever, and throat pain, then you can go for home isolation. Then as I mentioned in the previous video, you can go for the faster recovery through the 10 tips which I have mentioned. Wish you all a speedy recovery. If you like this video, click on the like button. If you have any doubts, post your comments.